Good afternoon, everyone. We're so excited to have you guys here for Annual Health Week 2023. My name is Dr. Linda Humaidan-Zayed. I am a Senior Research Specialist at the University of Illinois Chicago Center for Global Health. And we are very excited to have with us Professor Richard Jimenez of experience in public health practice, teaching, and research. He earned his Doctor of Public Health degree at the University of Texas School of Public Health in 2005. He has been an evaluator for He has been an evaluator for public health research, a Fulbright Scholarship Program, U.S. Department of State. He was awarded, I'm sorry, I couldn't see. There we go. He was awarded a Walden University Social Change Research Fellowship in 2017, the 2018 to 2020 Wilson Grant Award for Excellence in Research and Teaching, and a 2023 to 2024 Walden Faculty Initiated Research Grant. He is a fellow in Texas Public Health Association. His love for learning never waned, and he recently completed his studies in immunology at Harvard Medical School, HMX, and a Certificate of Achievement in Global Healthcare Delivery from the Harvard Medical School and Harvard Chin School of Public Health. Along his inspiring, outstanding career journey, he worked in the following roles: Centers for Disease Control and Prevention in Atlanta, Georgia as a public health advisor, Texas Department of State Health Services in Austin, Texas as a public health advisor, the University of Texas Medical School, Houston, Texas as a director, Center for Patient Safety Research, and the University of Texas School of Public Health in Houston, Texas, as a faculty associate and HIV/AIDS program director. He is currently a core faculty and professor at Walden University, and it's such a huge privilege to have him with us for this year's Health Week. And here we have with us today Professor Richard Jimenez. It's nice to have you.
Thank you so much. Good to be here. Thank you for inviting me.
Thank you so much for coming. So we have a couple of interview questions for you. First and foremost, please tell us a little bit about your journey as a public health practitioner and professor.
Well, it's been a very challenging, almost 40 years now of work in public health. I began my first assignment in public health was HIV/AIDS, the HIV/AIDS epidemic, eventually pandemic. So that was quite an eye-opener for me. So at the time, I was working with the grassroots community in the Houston area, and eventually found my way to the CDC in Atlanta, where I was assigned work with partnerships development in HIV and working with the America Responds to AIDS campaign. So I guess you could say my introduction to public health was a challenging one and although very interesting one. So my work actually took me all over the world on behalf of CDC and other agencies working with HIV prevention. So from the get-go, my work was in prevention, primary and secondary prevention, focused on HIV and AIDS and infectious diseases. So spent about, I would say, 20 years or so working as a public health practitioner. Then I transitioned to actually teaching. So for the last 15 years or so, I've been working as a teacher, teaching public health research methods and mentoring doctoral students. So this has been a very interesting ride for me, so to speak.
That all sounds amazing. Thank you so much for sharing that. And what is your public health role in addressing global health challenges like emerging COVID-19 variants, global warming, medication abuse, and among other emerging health issues?
So I guess you could say that I'm working indirectly with these global health issues, including HIV, including malaria control, TB. The majority of my students are clinicians who, from all over the world, we're an online university, so we have faculty and students from all over the world looking at these public health issues. So indirectly, I work with these issues through my students. What I find very interesting is that lessons learned way back in the 80s and the early stages of HIV/AIDS apply for these other diseases as well. And certainly from a public health perspective, looking at the health of communities, we're looking at primary and secondary prevention as our as our main focus. So in other words, primary prevention, keeping people healthy and uninfected with viruses and other diseases. Secondary prevention, keeping those, or at least trying to mitigate those who are infected, mitigate the course of the disease and keep them from infecting others. So prevention is still, a huge focus on my work, although I'm doing it indirectly through my students. Not only with COVID, as I mentioned, but other infectious and chronic diseases.
That sounds great. And, as a public health practitioners and professionals, prevention is definitely the key to public health. So that is awesome. The third question is, if equity is to be fought for like freedom, how do we approach this fight across systems?
That's a great question. And I'm really glad that you included the focus on systems approach, system-wide approach to looking at disease prevention. In the last few years in the field of social epidemiology, researchers and practitioners have begun to look at disease prevention, not only from an ideological type of agent, biological cause of disease, but also the environmental aspects of disease causation. So we're not looking at just a biological agent causes a disease, but going beyond that to look at the systems approach and the environment of risk that people live in. So we look at the individual behavior, but beyond that, look at factors that are beyond individual control. For instance, environmental factors, the society where individuals live, how does that community affect their health? How do policies from a systems approach affect health individually and as a group? So this systems-wide approach is the way to go, in my opinion. I think that we used it intuitively with HIV/AIDS early in the epidemic. And I'm glad to see that we are approaching COVID and other diseases, both infectious and chronic diseases, from a systems approach and looking at this environment of risk that individuals live in. So that means not only addressing clinical curative issues and looking at biological transfer, biological agents of causation of disease, but looking at policies that affect individual and community health, looking at laws that affect our health, looking at where we live, looking at nutrition, the foods that we eat, the foods that we have accessible to us. And in line with that, then we need to talk about health equity. And health is a human right. So we, I believe, as individuals have the right to a healthy life, both physically and mentally, but as a community, we also have that right. So I love the focus on the systems approach to disease prevention and pairing that with the curative medical approach.
Thank you so much for that, Doctor. Very well said. I definitely agree that a systems approach and health equity in and of itself is a primary core value of public health. So very well said. Thank you so much for that.
Sure.
From your perspective, what are the current health challenges prevalent in North America and how can they be addressed?
Well, certainly infectious diseases, including HIV, that is still around, it's still with us. COVID-19, although we've made some great strides in the past few months, couple of years, in addressing the issue, it's still with us. So I'm very concerned about that. Chronic diseases that affect us and are the causes of high rates of mortality, such as coronary disease, heart disease, all linked again to the environment. The behaviors, yes, individual behaviors, but beyond that, looking at the environmental risk factors, the environments of risk in which we live. So I think that we need to continue our efforts, certainly with COVID and other infectious diseases, but also look at the chronic diseases that are long-term and really affect rates of mortality and morbidity down the road. One of the areas that I have seen in my work, especially when I was a public health practitioner working with the public health system, is the public's tendency, and it's not through a fault of their own, but this tendency towards complacency. So, we have treatments for various illnesses. We, in most cases, are able to get those treatments out to the people that need them, to the communities that need them in an effective way. And therefore, that does impact. Lives get better, get healthier, but that doesn't necessarily solve the problem. So complacency, I think, is a really important issue that we as public health practitioners and researchers and teachers need to take a look at, to remind the public that yes, public health has been responsible for tremendous advances in the health of our nation and the health of our countries in North America. But we have to keep vigilant. We just can't let our guard down. And unfortunately, that's what I see that happening with COVID right now. This fall and winter, we're going to be faced with a triple threat, not only COVID-19, but also influenza and also RSV. Respiratory diseases that are going to be with us throughout the fall and are increasing in incidence as we go along. So we need to be very vigilant as public health practitioners to get the message out there to the community that, yeah, it's still a problem. We really still need to focus on this primary and secondary prevention efforts and do so from that systems approach that we were talking about.
Very well said, Doctor. Thank you. And the next question is, what is the highlight of your career as a 4-decade public health practitioner and currently a faculty at Walden University?
So as I mentioned, I transitioned from public health practice in the public health system to teaching. That was about 15 years ago. And I must say that teaching has been, first, let me back up and say that I am first and foremost, a teacher. That's how I started my career. Not necessarily in public health, but I was a teacher. So I got away from that as I entered into public health practice. And now I found myself back to teaching. And I must say that the students with whom I work are so inspirational to me. I mentioned, there are people from all around the world who are actually working out in their communities, want to increase their knowledge of public health, their skills, so that they can give back to the community. And that is so inspirational for me, and it really feeds me as an instructor and as a researcher. So I would definitely say this has been one of the big highlights of my career. I kind of miss public health practice and try to stay in touch with it indirectly through my students, of course, but I love working with the students, and I love to see their passion for public health, and I love to see their commitment for social change, positive social change, and utilizing the knowledge that they gain through their studies to better improve their communities, the lives of their community members. So that's great for me.
That is awesome. Thank you so much, Doctor. And as an alumni of Walden University, I could definitely say the professors and the resources and the core value of that positive social change at Walden University is what made me love it and what made me keep going and striving on, and that support from the professors. So thank you, guys.
Thank you.
And finally, last but not least, Dr. Richard Jimenez, any final words to the public?
To the public, I think sometimes the public is not fully aware or cognizant of what public health is. And I think that may be partly due to our own lack of information and getting out there. But I would like the public to know that the public health workforce is extremely diverse. So it ranges from lay workers, lay community health workers, to researchers, to scientists, health scientists who are looking at public health from a research point of view, to practitioners within the public health system, the local, state public health agencies, as well as the national agencies like CDC and the NIH. All of these individuals are all committed to working in public health and focusing on a community, on the thing.
I think, hello, Doctor? Do you hear us? Your screen stopped.
Better our lives now and down the road. So an appreciation and understanding of the public health workforce. And to also understand that the public health should not be separate from the traditional medical curative health model. In fact, in these days now we're seeing more and more linkages between the medical model, which is, a doctor treating a patient, and the public health community, which is focusing on the community or groups of individuals. So, we're saying to clinicians, use the time that you have with your patient as a teachable moment to do outreach to the extended family, both the family of the patient as well as the community. So that the public understand that, public health works with the traditional medical model for preventive medicine and care for the communities.
Very well said, Dr. Richard Jimenez. Thank you so much for answering our questions today and for this informative session. We really do appreciate you coming out and giving us your time, and we hope maybe in the future to hear more from you as well. So thank you so much.
Wonderful. Thank you for inviting me, and have a great, happy Health Week.
Thank you. You too.